My name is Dr. Jeff Bill, and I'm the founder and CEO of Sunrise Treatment Center. After I finished my family medicine residency in the summer of 2006, I returned to my hometown on the west side of Cincinnati to begin private practice. At that practice, there was another physician who was already certified to prescribe Suboxone to treat people for problems with pain pill and heroin. Since she was leaving the practice, she asked if I would go ahead and do the training so I could continue their care. For the next year, I tried to provide those services out of that family practice. But all along, I thought that if I could find a space to really focus just on the addiction care alone, that it would work out much better for the patients that I was trying to serve. And with that, a year later in October of 2007, Sunrise was born. In the years after I founded Sunrise, I sought out more and more experiences working with other organizations to provide medication-assisted treatment. What I noticed was that the offices were mainly focused on the clinical services and didn't have as much involvement from the medical side. From my perspective, since we were using medication to help people with their substance use disorder, I thought that it should be an office that looks and feels and runs like any other office where any other chronic disease process is being managed.
If someone needs a higher level of care, if they can't stabilize at the outpatient level, if they no longer have the resources in their community or in their home life to be able to put together a couple days of sobriety and then a couple more, then we need to have a plan in place to offer them that help and that support, and that's what PHP does. It provides that support, and then we provide the housing to keep them safe day to day until they can accomplish this more successfully without that extra support.
So when the client enters services, they're assessed and then placed in a level of care. Typically it starts at a 2.5 level of care, which is partial hospitalization. So they are provided supportive housing. They come to group 6 days a week. And then as they progress through that and their level of care drops, we have a 2.1 program. And then we also have supportive housing for that as well. But they have a little bit more freedom to gain employment, just autonomy in the community.
What makes Sunrise different from the other providers here is we have a very tight-knit staff. Our staff will each stop individually to make sure whatever each client needs, they get. We have a more home environment for our clients. It's not, it's a clinical feel, but we still want them to be able to have long-term success. So we have the program built to where they have the step down. They go from 2.5 to the 2.1 to outpatient. They have the options of having case management services. They get a full, well-rounded community built behind them. So when they're finally finished, however long that takes, they have a big community behind them.
The core values at Sunrise were rewritten in 2018 by a group of employees. We identified 12 individuals across our organization to work with our corporate and executive staff at determining what's important, what they see going on a daily basis, and what embodies us as an organization. So they came up with some amazing values that are really meaningful. Probably the most prominent one is treating others with dignity and respect. That goes to both staff as well as patients. We adhere to that on a daily basis. Other excellent values that they came up with have to do with innovation and creativity and forgiving mistakes. We talk a lot about loving and compassion and using those in our everyday decision making. There's no job that's too big or too small. We want to be the best at what we do and adhere to the highest ethical standards. So some of those are the core values that are critical to our day-to-day functioning. When patients arrive at our locations, they can expect a very clean and professional environment. Coming into the doors, into the waiting room, the furniture is well kept. It is organized, it's not in disarray. We have color palettes that match all of our locations. The artwork we put on the walls is very nice. Many of our locations have inspirational artwork, and other ones just have very nice scenes in them. We're proud of the work that we do, so we have our certificates all framed and our licenses and certifications clearly displayed for our patients. So from just start to finish, it's a very professional, clean, well-run experience for the patient.
One of our recovery housing units is located just outside of downtown Portsmouth, Ohio. Our main living space offers a spacious area with numerous games and activities, furnished with comfortable sofas and chairs. There is also a separate designated exercise room furnished with modern equipment. This unit has an on-site kitchen equipped with modern commercial-grade equipment, offering patients the space and opportunity to cook together. Bedrooms kept clean and comfortable provide patients with a secure area to keep their belongings with a dormitory-style arrangement. Our West Union Recovery Housing Unit is more secluded. Our large kitchen allows plenty of space for patients to prepare meals and promotes residents to eat together. This large living space allows patients to relax together, watch television, and play games together, with plenty of comfortable seating. Bedrooms offer dormitory-style living with secure space to keep your belongings. Our recovery housing maintains a comfortable environment to allow our residents to feel at home. The yard is spacious with plenty of room to enjoy nature. There's also a covered back porch, which is great for enjoying the fresh air. Our Portsmouth office is located on 11th Street near Fred's Pizza and Goodwill. The site services the residents of Portsmouth, Sciotoville, Ross County, Lawrence County, Ironton, Chillicothe, Waverly, and Rosemont. Our West Union office is located on CIC Boulevard off of State Route 41 near Walmart and O'Reilly Auto Parts. The site services residents of Adams County, including West Union, Bentonville, Decatur, Lynx, and the surrounding areas.